This is deliverable number 4, Merging Ethics and Information Technology. My name is Elizabeth Cattleman. I attend Rasmussen College. This is for Nursing 3472 CBE Section 1 Summer Course. My professor is Professor Coward. It's December 10th, 2019. Personal smartphone use and its implications in healthcare. First and foremost, consent is required of all parties before recording or eavesdropping activity. However, is the patient consentable at that time? Is it in a vulnerable condition? The specific condition that happened was that a nurse had taken a photo of a patient's foot ulcer because of uncontrolled blood sugars and posted it on social media. Was that patient consentable at that time? A question for that. I'm aware that at our facility we have a blanket consent for most therapies. However, photos such as this, for educational use that aren't life-saving, I think that there needs to be another consent just for photos. So, smartphones have improved communication between providers and patients, and has reported that education for their disease resulted in increased medication compliance. So increased communication, therefore patients are able to take their medication better. They can ask their providers questions. My blood pressure is this morning. Should I take my medication? Example like that. However, another study had discussed that in a bring your own device policy can cause distracted doctoring, where there's constant interruptions and creating a literal physical barrier between the patients and providers. So I've witnessed this myself. I ask a provider for help. I know they use their personal phone to manage other patients, but they have their phone on right now or it's ringing, when I'm trying to ask them a question. This is a huge increased risk of patient care errors because they're literally distracted doctoring. And then, of course, the smartphone isn't as functional as a computer. They can't read all their orders on their smartphone. They might, have a hard time using their smartphone versus a computer. And then smartphone etiquette, of course, and policies need to be important and in place at facilities to protect patients, as well as that etiquette needs to be taught so there's less patient errors and patients don't feel like my doctor's distracted, he's not paying attention. I know, again, at our facility we use smartphones instead of handheld regular phones for all providers, nurses, and doctors. And there's signs out telling the nurses these smartphones aren't personal phones that we're using. They're actually iPhones that the hospital gives to the staff every shift. So social media and its implications in healthcare, like we had discussed earlier with the scenario that the nurse had taken a photo of the patient's foot and then posted it online, there can be problems. So on social media, we can use it to promote health screenings, credible studies, and networking. However, there can be Facebook groups, for example, that publish information that's just whatever, and who's to say if there was consultation from a medical professional or not? But I've seen myself photos of a child's burn, for example, on a essential oil Facebook group. What oil should I put on this burn? It's obviously infected, or my child has had a temperature for several days. What oil? Things that aren't going to help. I know there's a Facebook a meme out there saying the oil of carvedilol for rapid AFib RVR. I thought that was pretty funny. So that's with not consulting medical professionals. It can be used unethically if the patient identifiers are used. So that foot taken a photo of, let's say the patient consented for it. However, there's in the background their room number or their name band, or it has some type of information on there. In really small communities, you can talk about, there's a story of a nurse who had taken care of a child who had measles. And because it was such a small community and the nurse had posted about it, she was fired because everyone knew it was that child. And so she was posting about it. And even then, it was even worse. She was posting in an essential oil or the anti-vaccination Facebook group. So it's like a double whammy. So another thing for all providers, nurses, and everyone to know that whatever you post, Facebook, Twitter, Instagram, you name it, even if you delete it, it can be tracked. So come back to get you if you're applying for grad school, new jobs. And it is recommended that providers have separate social media accounts. So you have a personal and a professional social media account if you want to get really into promoting health screenings and networking for healthcare providers. There needs to be, as a professional language, you have a high obligation to provide quality content, to protect the user's privacy, adhere to standards for professional services, online commerce, be trustworthy. It also, if you're in a professional social media setting, there needs to be strict privacy settings on there. So private groups, if it's a Facebook group, it needs to be private, and then make sure that what you're posting isn't going to have patient health information on there. And then, of course, you have your personal account too. So still be polite. Know that whatever you post is there forever, even if it's deleted. So regulatory bodies and ethical frameworks to protect patient health information. So there's HIPAA. We know about HIPAA, the Health Insurance Portability and Accountability Act. This first started in 1996 to promote privacy and security of protected health information. This has created national standards for electronic health records. So again, that's that patient health information. We want to either have consent and then not share it. Now, HIT, this is Health Information Technology. So this is similar to that clinical nurse specialist position. They're managing this type of technology, this type of privacy standards. Now, high tech, this is a national infrastructure which improved patient safety, reduced healthcare costs, decreased healthcare errors, minimized disparities in healthcare, and increased healthcare effectiveness and efficiency. With high tech, this national program, it decreased 19% in medical errors. So having a set standard for how we share information, therefore, very important. The Nursing Code of Ethics. This is a fundamental guide for nurses to provide patients with high quality care. So some things that are within the Nursing Code of Ethics is respect. How do we respect patients and ourselves and each other? Privacy. So how do we keep patients' information private? Professional duties. How do we carry ourselves every day? Consent. So patients require consent before we do anything in the United States. patients have the right to refuse. And then relationship, how do we carry ourselves amongst each other? How do we treat others, patients, and then other providers, as well as administrative duties? So speaking up. And I mentioned earlier possible legal consequences associated with unethical and illegal smart use and social media use. So someone had posted a photo of a foot. You could, possibly lose your license. If you're a nursing student, you could possibly get removed from that nursing program. And then most importantly, that patient is going to lose trust. They're going to be dissatisfied. They're going to be very concerned. The patient that had the measles information put out on Facebook, that's first off a minor, so they need extra protection. And second off, the parents too. So you're not just breaching the patient's privacy, but the parents' privacy too, because they didn't consent to that vaccination, and now everyone knows. I don't even. How is that child going to feel going back to school? And then further down the line, because this was posted online, this is part of their life forever. Even if that information is deleted, somehow it's going to follow them forever. So these are my references. And thank you for attending my deliverable number 4, Emerging Ethics in Information Technology. We all know that it's important to protect patients, be careful of how we're using technology because it can be used as a great tool, but with great power comes great responsibility. Thank you. Have a good day.